Hello, everybody. Welcome to our latest community conversation here at Atlantic Health System. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health, and today I am so excited and thankful to be joined by Dr. James Wittig. He is the Chairman of Orthopedic Surgery at Morristown Medical Center and the Medical Director of Orthopedic Surgery, Orthopedic Oncology, and Sarcoma Surgery for Atlantic Health System. Dr. Wittig, thanks for coming in.
Hi, Luke. Thanks for having me. I'm excited to be here.
Absolutely. So if you don't mind, let me just give the folks at home a little sense of how this is going to work for about the next half an hour. If you haven't caught one of these before, Dr. Wittig and I are going to chat on a variety of topics related to the resumption of scheduled surgical procedures here in New Jersey. We'll mix in a couple of questions from the audience. So we thank everybody for submitting those via email over the last couple of days. And then obviously the whole conversation, in the event you're not able to catch all of it, will reside both on our Facebook page. And we are excited to announce that along with Facebook Live today, Dr. Wittig, you're the first one to participate in this. We are now on LinkedIn Live as well.
So exciting.
Pretty cool advancement
I like
there.
it.
Exactly.
I like it.
And,
I like it.
And we will air this on News 12 Plus too, so the whole thing can be caught on weekends, Saturday and Sunday in the morning. Check your local listings for times. It's all in the digital guide there on your cable box. So that's kind of the nuts and bolts of how this is going to work. Dr. Wittig, thanks for agreeing to do this. This is a topic that in our other conversations that we have gotten a lot of questions about, this idea of when surgical procedures are going to be resuming, because we're just very much early in this process since the resumption. I guess it was Tuesday that this process began, so we've only been at it as of this taping for about a day. How is the first day gone now that surgical procedures are back in this way?
The first day was very exciting. We had much of our OR nursing staff as well as our techs come back. They've been redeployed to other areas where their skills were very necessary to take care of some very sick patients. And it was very exciting to get back to taking care of patients and doing what we were meant to do, making people better and using our surgical skills to get them back up on their feet or using their arms and legs appropriately. And everything was very seamless. It was almost like it was back to normal. The only thing that was a little bit different was really our waiting room area, where there was virtually nobody in our waiting area. Okay. Naturally, with keeping social distancing and rules about having visitors, we don't really have too many visitors in the waiting room, just the immediate family member. But everything went very smooth and seamless.
Awesome. That's great. And so in many ways, it's funny, that idea of no news is good news kind of thing. This, for patients who have been waiting or have had to wait because of the governor's moratorium on these procedures, and obviously that was done with the intent of ensuring that the hospital systems around the state were able to have the necessary capacity to deal with the COVID-19 pandemic. So certainly an understandable move there from the regulatory standpoint. But for those patients, I'm sure they are pleased to be able to come back in too, because for many of them, it's putting off procedures that have an effect on their quality of life, I would imagine.
Sure. So, for the last 2.5 months or so, patients' procedures have been postponed. We've continued to do surgery at Morristown Medical Center and through the Atlantic Health System, but we're performing what's called time-sensitive surgery, meaning surgical procedures for patients who were either in extreme pain, had a cancer diagnosis where it could not be delayed, or where any delay in their care would compromise their health in some way. Mm-hmm. And now the governor has given us the clearance to what the governor refers to as elective surgery. We call it scheduled surgery because elective gives you sort of a false sense that it's not necessary surgery. These are all necessary. It's not optional. It's just the timing of surgeries that are optional. But many patients have been putting off their knee replacements. Patients tore their menisci in their knee and have failed conservative treatment. They have painful bunions in their feet. They tore ACLs. They have benign types of tumors that have arisen. So these patients really need to start to get their problems taken care of before they become worse.
Okay, so let's start with that from a nuts and bolts standpoint. So let's say, for argument's sake, I'm a person who has one of those conditions, tore an ACL. I'm not as athletic as I used to be, we'll say, which nobody would argue with. But let's say I don't know the process of getting this restarted. What what is the first thing for our audience out there that they need to know to do to begin resumption of these, if they need these surgical procedures, what should be the very first thing they do?
Well, if you know that you need a surgical procedure, you've probably seen your surgeon already sometime
Sure.
in the past, so you should really recontact that surgeon and set up an appointment, whether it's via a telemedicine appointment or it's a direct office visit at this present time. You should start with that step. You should also contact your primary care doctor and inform them that that you're going to be undergoing a surgical procedure, or you'd like to have your surgical procedure performed at this time. If you've injured yourself, or if you have a problem and you don't have an orthopedic surgeon or a primary care doctor, you should really visit the Atlantic Health System website and go to our Find a Doc page and find a doctor and initiate the process.
That is, by the way, for those who haven't seen it yet, right at the top, when you go to atlantichealth.org, you'll see it as one of the top items on there. Just click on that, and as Dr. Wittig said, you can enter in information there about where you are and find a physician who can help you out. So that's step one, right? But I would imagine too, and we took some questions from folks about, all right, so maybe I've got a doctor and maybe I know I need to have this procedure and we're ready to go, but they have lagging or sort of nagging concerns about coming in for a procedure. And of course, those are undoubtedly tied to COVID. Can you give our patients at home a sense of how we are taking steps to make sure they're safe? What are some of the things the patients do in terms of testing before a surgical procedure now that we've resumed these processes?
So, the first thing I wanted to talk about a little bit is that I think a lot of patients over the last 2.5 months have had the feeling that chaos exists in the hospitals.
Right.
And it's exactly the opposite. I had to round on the weekends on all the COVID units from an administrative capacity, and make sure that things were going smooth. And I found it extremely peaceful and organized on all the COVID floors. Since then, I think everybody's aware that the incidence of COVID infections or the COVID population has undergone a dramatic reduction. And we're probably at this point in time throughout Atlantic Health System, Morristown Medical Center, our COVID population represents about 10 to 15% of our entire bed capacity. So there's a very small population of patients who are inflicted with COVID in the hospital. These patients are kept on entirely separate units. They're in negative pressure rooms. Any nurses or physicians or other healthcare workers taking care of them are wearing N95s and taking the strictest precautions.
Cleaning,
So,
we have very strict cleaning regimen.
very strict cleaning. Any of our rooms that have had COVID patients in it, any of our floors or our wards, they've undergone the strictest disinfection.
With technology too, right? We have a lot of those cleaning robots and things like that, and all sorts of equipment at play to make sure that these rooms are safe places to be.
Yeah, and then the final step was subjecting all the rooms to ultraviolet light,
Right.
and sterilization processes. We have a seamless pathway through the hospital for non-COVID patients. We have elevators that are reserved for COVID patients. We have special transport teams for COVID patients. If you're having surgery in the OR and you are a COVID patient, you're going to be treated in a special room that is entirely separated from the main OR, that has negative pressure, special filtration systems in place, and special precautions that the nurses, the doctors, and the techs take to ensure the safety of the rest of our patients also.
Very, very reassuring for our folks. Do patients who are expecting to come in for a surgery and once they're scheduled, is COVID-19 testing, diagnostic testing, part of a regimen for them before they come in for their surgery? How does that work?
Yeah, so we want all our patients who will be undergoing surgery will be screened or tested for COVID. Naturally, these patients are asymptomatic. We're not going to be operating on symptomatic patients, right? So they're asymptomatic patients, and everybody will be tested. There's a demand that they quarantine a few days before the testing, and that the testing be performed approximately 72 hours prior to the surgical procedure, and that they quarantine after the testing up until the day of surgery. And what we mean by quarantine is we really want you staying at home, really trying to isolate yourself from your family members, ideally wearing a mask and not coming into contact from anybody external to your home. And most patients will be negative. Most patients who are asymptomatic, there's only a 2% positivity rate.
Wow.
So most likely you're going to be negative.
I'm wondering, once you're through that process, how are we prioritizing who needs to come in? You know, in terms of, I'm sure in your particular practice, there are certain surgical conditions that require more immediate attention than others. How does that process play itself out?
Well, to a certain extent, that's up to the individual doctor. But what we've done is we've taken the first 6 weeks getting back to surgery, and we've defined that as our time period where we are going to get caught up with patients who've postponed their surgery and who've had to be waiting for a couple of months to undergo their surgical procedure. And naturally, the individual surgeons will be reaching out to all the patients where their surgeries have been postponed and seeing which patients are in the most pain or the most debilitated from the surgery, and then sort of triaging patients appropriately that way.
So it's not sort of a blind process. There's a thought process behind that specific hierarchy, for lack of a better term.
Correct. Now, it doesn't mean that we're going to stop taking care of time-sensitive cases. We're still going to be having time-sensitive patients coming into the physician's practices who are going to be need surgery expeditiously, and those patients will also be brought in as soon as possible, and continue to provide the best extraordinary care in a safe environment.
We have a couple of case-specific questions I want to get to in one sec, but before we do, I know we have a lot of folks who are watching from our hospitals, from our medical centers around the area who are watching this today, and I know that we touched on this a little bit, but I want to give you the opportunity to kind of expound on it a little more deeply. For folks like yourself, surgeons who have dedicated their lives to this kind of work, and for our nurses and techs who take great pride in the nature of the work they do in the operating theater in this type of space, how rewarding is it to be able to get back to doing that level of work? I know that this circumstance was unlike anything prior, and so everybody had to adjust accordingly, but there must be a certain level of appreciation and gratitude you feel for being able to come back to doing that work.
Sure. So I think the surgeons, the OR nurses, the OR techs, we all share common passions. We really find it rewarding taking care of patients from a surgical perspective and getting them better. We were all trained to do that. That's what our passion was to be able to make patients better by doing surgery. We're somewhat of a family in the OR. We all work together as a team. And I think that right now, with us getting back to doing more of a normal schedule, we're all very happy and excited to see the patients coming in and for us to be able to play a hand or be privileged enough to take care of these patients and make them better.
Awesome. Thank you for saying that. I want to get to a couple specific questions we have from some individuals who emailed us in. Gail emailed to let us know that she's scheduled for an elective partial knee replacement surgery next month. And she wanted to kind of just get a sense of some of what we've already talked about, her procedures, the procedures we're taking to bring people in. So we've already kind of covered that. But can we talk about a partial knee replacement surgery and how important it is that work get done and what Gail has had to go through for having not been able to do this, and now where she may be able to go from here having it done? Sure.
So Gail, that's a very good question. So I imagine your surgery has been postponed if it's already scheduled for next month, and you're undergoing a partial knee replacement as opposed to a total knee replacement. Partial knee replacement just replaces half of the knee joint on one side of the knee. So it means that your knee has not completely deteriorated. But what's important is that you get this taken care of expeditiously as opposed to putting it off any further, because the disease or the degeneration or the arthritis in the knee can get worse over the course of time with you walking on it or whatever other activities you do, and you'd like to prevent yourself from having to need a total knee replacement or having both sides, which is a much bigger procedure, much more potential complications associated with it. And I think now is the time to get it done.
Great. So good news for Gail then that she's able to get back in and to get this scheduled and done. Joyce wanted to know, and we touched on this a little bit, but now that scheduled surgeries are once again allowed, the policies or procedures that are in place to thwart the spread of COVID-19. And we sort of touched on that a little bit. I would imagine that that's a very common concern that we're seeing amongst some of our viewers, and I would imagine amongst your patients too. Have you had anybody reach out to you to say, is it safe for me to come back? Dr. Wittig, you and I have talked, we know we need this surgery, but I'm concerned about it. Have you heard from patients expressing concerns about this?
Sure. All the time patients ask me. And I think that, it's extremely safe to have surgery now. Like I said, the COVID population has diminished dramatically. Mm-hmm. We have safe COVID-free pathways throughout your care, whether you're coming in and going home the same day. Some of our ambulatory units were closed down during the whole,
that's right.
Right, and everybody will be tested. There will be no COVID patients that have even entered those buildings. Mm-hmm. Of course, everything is being sterilized and cleaned, and we're wearing masks. We're using gloves. So everything
following
is
the CDC
being done.
guidance, all that stuff.
Exactly. You will be in a room that has been completely sterilized if it's had any COVID patients in it, and there's many floors that had no COVID patients in it. That's right. Throughout the system. So
Joyce, thank you for, hopefully you find that to be a little reassuring, and for other patients out there the same way as well. Thomas has a condition that actually in my family is something that my family is dealing with. My father has this as well, spinal stenosis. He was scheduled for a spinal stenosis procedure in March that was postponed. And so he's wondering how important it is to come back in and get rescheduled. So now that he's able to, Thomas should reach out to his physician and try to get this rescheduled. What is spinal stenosis? What has Thomas's experience been like?
Sure. So Thomas, it's a great question, and I'm sure you are aware there's different degrees of spinal stenosis, and you could be affected to a different extent and have different symptoms from it. But it's a progressive disease, and it gets worse over the course of time. What it is, it's a narrowing of the spinal canal, and the exits, or the holes where the nerve roots exit from the spine and go into your extremities. And they narrow, and they cause you neurological problems. Mm-hmm. So patients present with pain, often weakness in their lower extremities. They can have some numbness. They can have radiating pain, nerve type pain. And the worst potential is that it gets so severe that it begins to cause bowel and bladder problems. Mm. So I think, I don't know what stage comes to that, but I think that it's very important not to delay treatment any further if you've already delayed it for a few months, and to get it taken care of and to contact your doctor and discuss it with them.
And it is safe to do so, because Thomas had a question about the safety element as well. And so hopefully our other questions have reassured him in that space as well. I want to pivot to something that you and I have talked about in other forums and in other concepts, but this idea of post-surgery and recovery, right? This idea of where's the best place to recover and what we're doing for patients. How has that, how have we examined, or are we re-examining that in light of what's going on here? And are we looking at maybe having home be more of a frequently used place for recovery for surgery patients now?
Sure. So I think most doctors' opinions is that you're always best off being home whenever you can be. And for instance, for our total joint replacements taken care of at Morristown Medical Center and throughout Atlantic Health System, about 85% of our patients go home after surgery. About 50% of them go home with home care, and 50% of them actually do fairly well and do not need home care. So it's very variable who needs home care, but there's different things that we can do. We can set up telemedicine visits for your home where you're followed at home via telemedicine. We can have physical therapy do telemedicine appointments with you as part of your home care. And we could have visiting nurse services come in who take all the appropriate precautions. They will never see a COVID patient and then take care of a non-COVID patient.
Right.
After that.
The back
They
to
will
back.
always take care of the non-COVID patients first and maintain strict guidelines with a mask and their gloves, et cetera, social distancing. So there's lots of ways to recuperate at home. If you have no choice but to go to a subacute nursing facility, then we do have a list of subacute nursing facilities that we work with that are taking just non-COVID patients and those that are taking COVID patients. So we can also keep you separated in that realm.
So it's not one size fits all, it depends very much. And so folks should presumably communicate with their surgeon and their doctor about what's the right appropriate arrangement for them then.
Definitely, definitely.
How have, from a surgical standpoint, it's an area, it's a field that is always evolving and always changing. Do you think there are lessons we've learned or are there experiences you've had over the last couple of weeks that will stick with you and stay with you throughout this process? Do you think we continue to ideate and continue to refine our practices and to get better all the time? Is there anything that sort of stands out to you about where we've been versus where we're going kind of thing? Or is it?
Well, I think there's been a couple things that I've seen. And one, this is Mother Nature that's doing this. We have no control over this, but it's pushed us into the realm of using telemedicine, which I think is very, very helpful in taking care of patients. And
In orthopedics in general, or in across all
I think
disciplines?
throughout all of healthcare, but in orthopedics in general, it has been very useful. And I think that we could have appointments more expeditiously. In general, orthopedic patients are a little bit debilitated, so to be able to have an appointment from your home rather than having to drive to an appointment and walk around from your parking spot up into the office. So I think it helps in many ways. One thing, though, that I've seen, is the delay in healthcare and the problems that causes with patients. Personally, I practice orthopedic oncology, and I take care of a lot of sarcoma patients.
How's that been?
And it's been tough getting toward the latter weeks, particularly the last couple of weeks, because I'm seeing patients who initially neglected their pain and other symptoms, and now are presenting with very big tumors or very big cancers that would have probably been much smaller had they been detected a couple months ago, and would have perhaps made their treatment different or their recuperation a little bit different. So I think, I think right now, my word to patients is, it's safe now. Don't delay your health care anymore. See your doctor. If you need to have surgery done, get it taken care of. And there's also the concern that we hear about, although nobody really knows, is will this come back again in the fall?
It's a great point.
Right? You're much better off being mobile if this comes back than being immobile and debilitated.
Yeah, Brian Granulotti talked about that not that long ago with this idea of nobody really knows for sure what the next normal is, how the future may present itself. And so as we look at the fall, the last thing I would imagine some of your patients who have some of these very tricky and very painful cancer-related surgeries would be to say, boy, I wish I would have addressed this back in June. Then it would be in a much different place now when it's even that much harder to get it taken care of.
Exactly. I think that would be the word from a lot of the patients, that they should have reached out, contacted their doctors, at least done a telemedicine visit, not ignored things. A lot of times things get ignored because patients feel like, oh, I twisted funny, or I rolled over in bed, or I slept funny during the night, or it's with kids, a lot of times it's growing pains. A lot of children's tumors are missed because it's attributed to a sports injury, or something minor that they did, but they end up having a tumor that's been growing. So we've seen a couple instances of that also.
Yeah, interesting. Well, Dr. Wittig, we're kind of winding down here on time, so I want to thank you again for taking an opportunity to do this and to put a fine point on it. As we started our conversation in the beginning, we talked about the news of the week, and that, of course, is that the governor has lifted the date upon which the moratorium ended on scheduled procedures is now come and gone. And so for folks out there who are saying to themselves, you know, I had an appointment, it got postponed, or you know, I've been waiting for that really tricky appointment that I've been putting off and putting off. Now they have an opportunity to do that, and whether it's with Dr. Wittig or any of the other surgeons we have here at Atlantic Health System, I guess we'll drive home that final point for them one more time. Now is the time to seek your care. Is that a fair way to phrase it?
It is. Now is the time to really seek your care, follow your doctor's advice, and if your surgery was postponed, speak to him about getting on the schedule to get it taken care of and recuperating over the summer.
Yeah, what better time to relax and stay, you know, seated, I guess, than when the weather's nice and you can sit on the deck or lay back in the sun and rest easy, I guess. Huh?
Yeah, and you know, we have over 200 orthopedic surgeons throughout Atlantic Health System, all of outstanding quality. So you'd be very well taken care of by any of our orthopedic surgeons throughout the entire system.
Awesome. Dr. Wittig, the chairman of orthopedic surgery at Morristown Medical Center and the medical director of orthopedic surgery, orthopedic oncology, and sarcoma surgery for Atlantic Health System. Thanks so much for taking a moment to chat today.
Thank you, Luke. Thank you, everybody.
All right, folks, once again, Facebook Live, LinkedIn Live, the full file will be available for you to view in our timeline there. And of course, News 12 Plus on the weekends, Saturday and Sunday. I'm Luke Margolis. Thanks so much for watching our community conversation, and we'll see you next time.